Just a few corrections. So the European Liver Patient Association is based in Belgium, in Brussels. But I'm based in Slovenia and I'm based in Croatia. So I live between Slovenia and Croatia. So I was super excited and happy to get this invitation. And I just want to say from my heart, dobrodošli. So dobrodošli is Slovenian for welcome. Dobrodošli is also Croatian for welcome. You see, we are very close together. I have here the timer just to be sure that I will not overstep. The green. Okay. So you go to the education, and now what? What can you do more with the education, or what is happening? So my name is Marko. I have a rare blood disease, and I work in the liver space with a rare blood disease. How strange. Yes, because of my drugs that I had to take, I was infected with several different things. They affected my liver, and this was like a short version of what happened. So first, why patient involvement matters. I don't know about you, but I feel like at home. So I was sitting there, and then I heard a nice gentleman from the US, and I heard some cheering and everything, and I was sitting there thinking to myself, yeah, this is my tribe. This is my kind of people. I really like it. So thank you for that welcome introduction there, because, you know, this is something that we need to use. Europe in the next 5 years, 10 years, 20 years, and I'm sorry, I can speak only about Europe because I work in Europe, will need a strong patient advocate that have a clear overview of what is happening in the space, because only then you can talk to someone who is on the other side. If you are talking as a naive person and you want to change the clinical research protocol, you will not know what to ask or what to do, or they will invite you to ask questions, but you will not have the idea what exactly can be changed. And this can be changed if you go to any treatment. So people do tell me that I'm a certificate collector. So I have 3 master's degrees. And I have like 90 or 100 different certificates, but this was only from the need to understand what is happening. So I was elected in the Pharmacovigilance Committee at European Medicine Agency. They started to talk. I was listening and I was thinking to myself, oh man, this was the step in the wrong direction, because you cannot understand anything they're saying. So it took me half a year to understand what is going on. So what is pharmacovigilance, what they are talking about, in order to be able to ask the right questions at the right time. So in order to be able to have the right questions at the right time, we need to do some kind of a briefing education, and ELPA here is one thing that is really, really good for that. So we are aiming to not be the subject of medicine, but we are aiming to be partners. So I would really like the doctors to ask me, or pharmacologists or whoever, what exactly are the treatment plan. Because in the patient community, we often see that patients, they say, okay, you know, something is wrong with me, I will go, you do your stuff, and I will go and do my stuff. So I don't want to know about the procedures, I don't know about what is going on, just cure me and I will go. Which is great if you have a disease which can be cured like that. But if you have a chronic disease, then you are in constant communication with healthcare authorities. You are in constant communication with medical experts. And it would be great if you are briefed in a way that you understand and you speak their language. So at the beginning, I was sitting here thinking to myself, yeah, this is my tribe, this is my language. You should feel like that when you are sitting at the table with medical experts. You should feel like that if you are sitting at the table of regulators. So can you imagine regulators talking about who holds the drugs and what drugs are used, what are the side effects, and then you are collaborating as a, I need to smile, thank you. So the life cycle of medicine, of course, it begins and it ends with patients. And in between you have patients contributions. As you saw, a really nice slide from Ingrid, you know, the very busy slide, but it's busy because there are many points where patients can chip in, where patients can also contribute to the discussion. So it also, involvement gets meaning to the innovation. And when we participate, we bring something that medical experts unfortunately cannot see. And that is like, the impact on quality of life. I spoke also to some oncologists. They were super scared to talk to some patients because there were some endpoints they were really concerned about the clinical research. But when they spoke to the patient, these were the things that the patient was not concerned with. So when we are talking, when we are discussing, we then can arrive to better outcomes. So let's see about this region where we are now. We can divide it in East, Central, West. But if you look at the healthcare systems that we have, you can see that the West countries and healthcare systems from West, they are very well established. They have already procedures. For example, at the beginning of this year, European Union has changed the way that we approve drugs, and we will approve medical equipment with new health technology assessment procedures. And they wanted to make sure that we will involve patients. But for example, Germany already involves patients in that process. But we have now this law in place in order to involve patients also to other regions. So I see West as a very well-established frameworks, policy, continuum, and integration of all the partners. But just hear me out. Integration. The next thing is, if you look at the East and Central, you have a lot of community energy, like ideas of what are we going to achieve, do, a lot of resilience, adaptability, but patients are not so involved into the decision makers at the healthcare level. And I do know this because for a brief moment of time this year, I was director of Public Agency for Quality of Healthcare in Slovenia, and I saw that who are we inviting and what we are doing with patients. So the Central and East healthcare systems, they have patients who want to be involved, and you have a lot of, you can see a lot of energy there. So if you combine this together, you will get like a ideal healthcare system with the right procedures and healthcare system that will involve patients. So patients are involved in different healthcare systems, also in West and East, but they are involved in different stages and also from different disease areas, not all of them. But if we combine this, we will have something like when structure meets people, policy will meet passion. Did you ever hear a patient talk? So they talk like me, very passionately. And sometimes medical experts are afraid, of all this passion. We need facts, we need data, we don't need passion. And that's why empathy training is also great. So you take your passion and you just turn it around into something that is also understandable for other side, for the medical experts, and how to integrate that into the final decision. So just let me give you an example what you can do after you finish the training. So we had a European medicine research project. So we at ELPA are involved in 20 of them, together with 299 universities, principal investigators, so all different partners. And we were invited to one project where I was asked to communicate on clinical trial design. So the clinical trial design was shaped in a way that they offered 3 biopsies for the patients, which is great for the data, because for the data with the biopsy, you get like a very clear data, sometimes mostly clear, but for the patient, that is horrible. Can you imagine 3 times they will take something from your body and I said, yeah, from the research perspective, this is a great plan, but from the patient perspective, you will have problems getting people involved in your clinical trial research. So they changed this to fine needle aspiration. So if someone wants to know more about that, I can go into the details. But of course, also the data changes when you change the procedure and methodology. But in that particular project, the changing of this method from biopsy to fine needle aspiration did not impact the final result in a way that they would be worse. So the result was good. So if we are together, we are saving time, money, and people. So I mean people. So you can send different people to different events, and then you have everything, like you are doing right now. So if we come together, we gain strength, we gain visibility, and we gain access. So the first time I met Magdalena? Yes. So I remember this to this day because it was the first time we reached out to other patient communities. You know, patient communities, we work in silos. You have liver patient communities, heart patient communities. But if you reach out, then you realize that we have like same problems. We have lack of money, we have lack of time, and sometimes we have lack of people who would be professional, engaged, and do something. So this is something that we can save if we work together. So of course, FH Europe amplifies also every voice. When I was setting up my own patient association in Slovenia, I felt that I'm alone. When I went to the first meeting with other patient groups, I felt that, okay, I'm not alone, but I'm alone with some small groups from East. And then I went to the European, yes.
Okay,
yeah, just a minute. So when I went to the meeting with other patient groups from whole Europe, then I got the feeling that, yeah, I see some people that are in my tribe, and the same that I did, that I felt when I came here. So a big, strong European patient association can amplify your voice. And this is good for all of us. So can you imagine that I'm a commissioner and I invite you to a very high-level strategic meeting and you have no clue what to say? Then in my mind, I will say all the patient groups are the same. We will not invite them anymore. So that's why we need to upscale our professional level of knowledge, what is going on. And of course, again, ELPA is something that gives you that, that confidence that you can come and you can talk to everybody. So this is something that I got from ELPA, the confidence that you can really state what is the main problem. So imagine what is next. Imagine that we have every patient can co-create medicine development. Imagine regulators, scientists, and patients, they are designing something together. Yes, they will design something together when it is efficient. So efficient is when all the stakeholders know what they're talking about and they are saving time and money. Efficient does not mean that I'm at a table and I have no clue what is going on. Then we have a waste of money. So we need to change that and turn it around. So of course, something that we can do right now. So we join together. So like liver community and also your community. Then you can take the training. I will say it's a little bit tough here and there. But when you are doing, you are really getting the whole picture. You can read it yourself. You can do you can go and read it yourself, but with the ELPA training, you get an overview of the whole process in one place. So, and I was happy to be nominated, and I'm part of editorial team of ELPA. So everything that you will learn and is not good, you can come to me and say, Marko, what is happening there? But I just started, so please give me some time to just... And of course, we can then reach out and offer the expertise of patients in regards of health technology assessment. Because for me, as a patient representative, this is the main thing in Europe. We will change the way we are approving medicines and we are approving medicine equipment. And we need patients who will not only contribute, but understand the process and then contribute at the right place. Thank you very much.